us to find a private system which would reflect a more cost-effective nature than a public system.
Now, back to Oceanside. You know, we're a community of, 30,000 people. We include the community with the oldest population in Canada, Qualicum Beach, and the 4th oldest population in Canada, Parksville. Yet, we have no hospital. We don't even have a health care center. Now, how does that possibly meet the principle of accessibility? It doesn't. I agree, it doesn't. But we're told that maybe there is some good news. There have been newspaper stories recently quoting our MLA, Ron Cantillon. Ron, I don't know if you're here this afternoon. Oh, no, I'm afraid he isn't. Anyway, Ron has been telling us that a new facility for the area is a go. However, you know, I remember that old saying, the devil is in the details. We have not heard one word about what services this healthcare center will provide, only that it's a go. Gets a good headline, doesn't it? So what services might be available? Will it be a first aid station? Will it be a kind of extended after-hours walking clinic? Will it have any urgent care facilities? Will it be a hospital? We don't know if it will even begin to approach adherence to the principles of comprehensiveness. And what about the principle of public administration? Yes. I think we all know that both our national and provincial governments are committed to a deeper and deeper integration of Canadian business, military, culture, and indeed our entire way of life with that of the United States.
Our system is being privatized because there's a number of corporations in Canada and the States that would love to make a profit off healthcare, and so they'd like to set up clinics, and they'd like to make money off the ill people, and that is not, in our opinion, is not right for people. Should not have to pay money, especially since we have a Medicare system in Canada, National Medicare Act, to access proper health care.
British Columbia has the highest density of private for-profit clinics in the country. It's certainly an issue for us. It's been an issue for some time. It started and is sort of highlighted by the largest private clinic in Vancouver, being run by former CMA, or Canadian Medical Association, President Dr. Brian Day, which has currently become a very peak issue, as he's now launched a lawsuit against the provincial government in BC to try to find our legislation, our healthcare legislation, unconstitutional. This would allow private insurance to be purchased to access what are now considered medically necessary services, and which are paid for and covered under our medical services plan. So these private clinics have come together to actually challenge our legislation in BC and hopefully, in their mind, break it, so that what they could allow is a US-style private health insurance industry to come in and create a very true two-tiered US-style healthcare system here in BC.
Now, I remember it's about a year or so ago that Don Koopman was quoted as having expressed interest in building one of his private clinics in Oceanside. Even though the American example of private facilities funding shows what can only be called profiteering, that results in 20 to 30% overhead and profit for owners, with the record of this government, I'm concerned that this will be one of those very large devils in the detail. And so, when we finally have these details announced, and I predict it may be around 4:30 on the afternoon of Christmas Eve, It's going to be our task as a community to assess them against the principles of the Canada Health Act for comprehensiveness, accessibility, and especially for public administration. This new facility must not be private.
As you know, Comox area, Comox-Campbell River area declined that regional board to go with a P3 to replace their 2 hospitals, and they won that one because they stood firm, which is what we should have done in the CRD. So good on them. It'll be interesting though, because as soon as they got into power, the Liberals, in 2002, they froze all capital funding because they knew what they were, and then they set up Partnerships BC, which literally hands over the construction of any project over $20 million to the private sector.
We and the other North Island people are fighting to keep healthcare public, and we are against the disastrous funding cuts that are announced by VIHA and the Liberal government. Our hospital and necessary medical services and preventative community services budgets have been slashed up in Campbell River. Right here, I'll get Joanne to here, hold up the headlines here. These are in our local papers and in the island papers. And I'll just read off a couple of them. Funding cuts may flatline intensive care unit. Surgeries canceled at Campbell River Hospital. Non-profits bleeding from small cuts. And that's in regards to the crisis center cancellations in Campbell River and all over the island, which is disgusting. Healthcare budget crunch impacts hospital. This is language that describes destruction and pain caused by VIHA's crisis management approach to healthcare and the Liberal government's failure to protect public healthcare. Now, I don't find fault with the doctors and the nurses and the hospital personnel, because they're doing all they can with the resources that they have. But I do blame VIHA for their chronic underfunding, short-sighted planning, and as our local orthopedic surgeon, Dr. Sommer, said in our newspaper, he said there's a disconnection between our hospital's operations and VIHA's management in Victoria. So it appears that neither VIHA nor the provincial government are acting on our concerns. People's lives are at risk due to their scattergun approach to healthcare and healthcare management. And what to do? Well, we polled of some of our people around the North Island. Here's a 4-point plan for the Liberals to enact or the opposition to fight for. Immediately restore adequate funding for all healthcare in BC, including providing money for needed new facilities and services. Eliminate VIHA and all the BC health authorities. And bring back some kind of a locally accountable hospital board or some other governance model to more adequately fund and advocate for our health services in our communities. Number 3, halt the further privatization of our healthcare system by calling for closure of clinics that are allowing privately financed purchase of core medical services, which clearly violates the Medicare Act. And finally, eliminate this public-private partnership P3 model for funding for new healthcare facilities. It's not accountable and it's too expensive. One last thing, Gordon Campbell, you know, he promised healthcare core services would not be cut during the recent election campaign, though the Liberals knew damn well that they would have to restrain their spending budgets earlier this year. Following the election, $360 million was cut from the health authority budgets on BC. Now, this funding has been reallocated by the Liberal government to cover cost overruns incurred by hospitals, including P3 hospitals, other P3 funded projects, Winter Olympics projects. And I want to close here by restating the headlines above a recent Paul Willock's article in our local paper, and it's right on there. No one voted for worsening health care, and by myself as saying this Liberal government, enough broken promises, enough is enough.
New concept of who we think we are, and that we care for each other in a community spirit, a community sense. And I think when you lose that, you really fall into a dark abyss here where the objectives are not for the welfare of the people. They're for some very unusual, narrow slice of the population, less than 1%, owning such a huge, vast amount of the currency and the assets in the countries.
There's a reason that public is in the name of health care. It's a public healthcare system that needs to be there for everyone.